So let's begin now. This is the occupational English test known as OET, and this is the listening subtest. Is the slide moving?
Yes, ma'am.
Thank you. These are the question types. As I told you earlier, listening has three parts, part A, B, and C. Part A is called the consultation extract, where there will be two short extracts of 5 minutes each. These are consultations between the healthcare professional and the patient. You have to take down notes. So these questions from 1 to 24, you'll have 12 questions in each extract. In the extract 1, you'll have questions 1 to 12. And second extract, you'll have questions 13 to 24. All these 24 questions based on consultations between a healthcare professional and a patient. It's very generic. Listening and reading are tests which are common for all the 12 professionals. So it's not going in depth into any particular body system or specialty. They're very generic. So you could have a consultation of a dentist or a veterinarian or a cardiologist or a psychiatrist or a podiatrist or any kind of body system relating to any health issue. They're very general, so everybody can understand this. All the 24 questions will be, there will be blanks that you will have to fill in. You have to listen to the audio clip and you have to answer the question. So this is about part A, 2 5-minute audio clips, and each audio clip will have 12 questions attached to them. You will have to listen only once to every audio clip. You cannot rewind the tape or pause it or forward it or fast forward it. You have to just listen once and answer your questions. Before you starting to answer and before the audio starts playing, you will have 30 seconds time to go through the questions. So this gives you time to just familiarize yourself with what is printed, what are the blanks, understand what comes before and after the blank, so that you can predict what kind of answer should be written. Now here, spellings are very important. Since you're writing on your own, you're going to listen to the audio and write. So you have to use correct spellings. However, if you get brand names of medications, you can write, you have to write it with a capital letter. The starting letter should be a capital letter if it's a brand name. And also, if you don't know the spelling of the brand name, you can write it as per the sound. It's called the phonetic spelling. You can write as it sounds to you. So if you hear something starting with K, it could start with a K or with a C. And even if it is not the correct spelling, you will still get a 1 mark for that because you heard it correctly and it sounded like K. That's called the phonetic spelling. So you will get marks for phonetic spellings. If it's a sir, it can be S or a C. If it is fur, it can be F or PH. So this way, you have heard it correctly, but you didn't know the correct spelling because it's not a familiar drug to you. And each different country and different location and area, geographical area, has a different medications name, different companies which manufacture medications. The brand names obviously would differ. Don't worry about the spellings for brand names. You just have to write as per the sound. Apart from that, for generic names of medication, you have to use the correct spelling. For example, if it's paracetamol, then you have to write the correct spelling because it's a global medicine. It's a generic name. It's the content of the medicine. It's the chemical name. Now, if it is Paracip, you may write P-A-R-A-C-I-P. It could also be P-A-R-A-S-I-P because it's a brand name. One particular company has given Paracip the brand name of paracetamol. There, if you don't know the correct spelling, it's okay. You just write the phonetic spelling. This is about part A. Now let's move on to part B. In part B, you have 6 questions totally. And each of these questions will have one multiple choice question. You'll have 6 extracts. So each extract has one multiple choice question. Before each audio clip playing, you'll have 15 seconds to go through the question and the options. These are all MCQs, as I told you. So you have to just mark the answer, either A, B, or C. You will have to circle. In the exam, you'll have your text booklet, examination question booklet. You just have to circle you have to shade the circle with your pencil, either A or B or C. You just shade the circle with your pencil, make it dark enough so that the scanner can scan your answer. So it's important to read the questions. You can underline keywords here. Throughout your listening test, keep underlining keywords, important words, facts, the numbers, the names, dosages, timings, all this has durations. All these are keywords. You have to keep underlining them. So each question in part B, you will have 15 seconds. You can go to the question and the options, keep underlining the keywords in the options as well as the question. Then when the audio starts playing, keep a bird's eye view, look at all the three options and then choose one best answer which relates to the question. Now, you will have 1 mark for every correct answer. Throughout the test, there are 42 questions and you'll have 1 mark for each correct answer. That is 42. All your 42 marks will be divided by the denominator, which is 42. What you score will be divided by the total number of 42 into 500. It will be multiplied into 500. Thereby, you will know your grade. Now, let's move on to part C. In part C, you have 2 extracts, and these are called presentation extracts. The longer extracts, where you will have one extract of about 5 minutes of length, and you will have 6 questions in each of the extracts. So 6 and 6, 12. Here, part B, you have 6 questions. So 12 plus 16 is 18. And in part A, you have 24. 24 plus 18 is 42. Now, part C questions are generally an interview style kind of podcast, or it could be a presentation of one person talking on a particular healthcare topic. So it could be somebody talking about a new medication, about a disease condition and its symptoms and treatment. It could be about some vaccinations being produced, or it could be some prognosis of an illness. It could be different things all related to healthcare, but there'll be 2 separate extracts and both will not be related to each other. The topics are different from each other. You listen to the audio and then here again, you will get 90 seconds time. So in part A, you get 30 seconds for each extract. In part B, you get 15 seconds time to go through the questions. In part C, you get 90 seconds, which is the longest time because the length of the audio is longer. You have to listen for a longer time. You have 6 questions from one particular audio clip. So you have to go through all the questions in 90 seconds, underline the keywords. These are also MCQs. You have 6 MCQs and you'll have ABC options for each. You have to shade the circle, go to the answers, go to the options, underline the question keywords and the keywords in the options. And once the audio starts playing, you start following accordingly. Answers are generally in order, so just go in order as you're answering, as you keep listening. You keep marking your answers and moving along. But they will not tell you the question number because it's a continuous talk, presentation. They will not tell you you're on question 30 or 31 or 32. They just keep talking. You have to look at the questions and see, listen to where they're talking and relate it to your question paper. In part B, of course, they will give you the question number. 25, 26, 27, 28, 29, 30. These 6 questions numbers are dictated by the speaker. The part C assesses your ability to follow a recorded presentation of length or an interview on a range of accessible healthcare topics. Now, let's go to the next slide. Can you see part A on the screen? All of you? Anyone can answer? Can you see part A? Sometimes my slides don't move, so I'm just checking with you. All right. On part A, as I said, you have 2 separate consultations. You have to complete the notes, which is fill in the blanks. You have 12 blanks or 12 gaps for each consultation. It's a conversation, it's a consultation between a healthcare professional and a patient. Or if the patient is unable to speak, it will be with the caretaker, the carer of the patient. You'll have 30 seconds before the recording starts. You have to read each question, underline them, especially underline the question. You have a blank, you underline the words before and after the blank. So that helps you to predict what kind of answer would come in the blank. That would be, it would be a noun form, or it's a verb form, or an adjective form, or adverb form. So it's important to know a little more grammar. Brush up your grammar, please. We have provided grammar books for you in the Dropbox. So please learn all the parts of speech to understand the different roles that nouns, verbs, adjectives, adverbs play in a sentence. Most important, the most information is based on the patient's condition in part A. You have to listen and answer simultaneously. You will not get separate time to write your answers. So as you're listening, you've got to listen, understand, think, and write. That is why they give you time beforehand to prepare. They give you time to go through the questions so that you don't have to read something new as they're talking. You have some idea because you get time to go through the questions before that. You have questions 1 to 12 and 13 to 24 in 2 extracts. You can write one-word answers or a short phrase. You must see what the instruction is. If the answer requires only one word, please write only one word. If the answer requires a phrase of 2 or 3 words, please write the short phrase. Terms and conditions are also given. Terms of the patient, conditions of the patient, treatment of the patient. All this is given in the Part A questions. Now let's look at some strategies for Part A. As you know, I have told you that the recording will be played only once. And you listen for details here. Listen to the details of the patient's case history, past medical history, symptoms, treatment done, present treatment. And if you look at it could be about current medication, it could be their past surgeries and illnesses that they've undergone, their lifestyle choices, whether they're living married or living with children or living with their spouse. Sometimes their profession is given. They may be a taxi driver or an accountant or a nurse or whatever is their profession. So they give all these details. So you have to look for details in Part A. Also, one clue for you is to look at the headings and subheadings and what words are in bold. These words in bold will be as a side heading, subheading, or a main heading. Your answers will be pertaining to the heading. Like if the heading is side heading or subheading is symptoms, the answer in the blank would be symptoms of the patient. If the subheading is medications, the blank words would be medication names. If the subheading is past medical history, words in the blank would be about the medical history of the patient. So those are some tips for you. Let's look at some other strategies. In the listening test, they may use idioms and phrases. Idioms are commonly used words or phrases which is not a complete sentence, but they're related to health. For example, you say, an apple a day keeps the doctor away. That's to do with health. That's an idiom or a phrase. It's like a small phrase. It's not, sometimes you don't get it as a complete sentence. So you may get usages like that. They may ask you what that means. You have to be familiar with these. We are also sharing on Instagram and Facebook and other social media different medical jargon and vocabulary and idioms and phrases. So please follow us on Instagram, Twitter, Facebook, and you will see all these helpful tips for you. You also have to identify the correct information in longer consultations. Look the correct specific details and information. Sometimes the information may not be medical. It's not always medically oriented. For example, if you say the patient was an accountant, that's a career, that's a profession. It's not medical. It's not medical information, right? And also, if we say the patient is married and lives with her husband, that's not medical, but that's the social background. You may also get social background. Or sometimes they may say the patient lives with her children. That is social background. So these are things which are not medically related. So you may also get that kind of information. You have to listen out for those details as well. Now, the patient's current and future treatment will also be Part A questions. You have to listen for the treatment given to the patient, what is the present treatment, what treatment was done earlier, and for the future, what is advised in the future, in the next 2 months or 3 months, what is advised for the patient will also be dictated in Part A. Look for different forms of medication, and different types of treatment, whether the patient is, maybe if the patient has carcinoma, they may have to do radiation therapy or different kinds of treatment like that. Or if it is sometimes tablets needed, or maybe injections or syrups or inhalers for those who have asthma. So you have to listen for different kinds of treatments and medication given. Similarly, describe the treatment that they have been following so far and answer the questions. So practice strategies which you think are best to complete the notes in Part A. Now let's look at Part B. I've already told you most of these things when we were discussing the 3 parts. You have 6 different recordings, which are shorter recordings, not very long. The time duration is 45 seconds. Out of this, you have 15 seconds to go through the questions, which is written here, 15 seconds to look at the questions. And then you have 5 seconds to mark your answers. So that's 20. So another about 25 seconds will be the audio. Totally, it is about 45 seconds for each recording. You identify gist. Gist means the overview, things in a nutshell, in a capsule form. That is the gist. You identify what's the gist of the whole talk. What is summary? Summary is gist. Okay, all these are on workplace communication. So here, most of the time, talks are between one healthcare professional and another professional. It's not like consultation between a patient and the doctor or nurse, any healthcare professional. It's between two professionals. That's why this part B is called workplace communication. How a nurse talks and communicates to another nurse. How you do handovers. Here it's written in the middle here. Briefing sessions or handing over charge or taking over charge from the previous shift nurses or doctors. One doctor may be talking to a nurse about a patient, or one nurse may be reporting to a doctor about a patient's condition and treatment, and how they are advancing, how they are responding to the treatment. So it could be not just one nurse to another nurse, it's cross section. It's between any medical professional. It is from between one professional to another professional. Maybe the same professional or a different professional. But they're all medical professionals discussing with each other all about the patient. Now, the speaker's purpose has to be identified here, and the details. What are they saying about this patient? What is the purpose of this talk? What are the minute details? When you listen to another nurse or another doctor, you'll always listen to the details. What is he or she saying about this patient? What medication they took? What time they took the last dose? What should be done this evening? What should be done tonight? What should be done for the next 2 days? So you have to listen for details. You also listen for opinions and functions. What is the opinion one nurse or one doctor saying? One doctor may say, okay, this is my opinion about this patient. Another person may say something different. Maybe some discussions on the opinions. Function, what is the role of this doctor's role in the patient's treatment? Course of action questions. The nurse or doctor or any professional, it can be a pharmacist, it could be a physiotherapist, maybe ask you, okay, what course of action? Okay, physiotherapist may ask, like, what am I supposed to do for this patient? How many sessions of physiotherapy should I give? Or how many days should I give it? How many sessions per day? So there are all courses of actions also discussed in this part B between professionals. Look for specific details within the interactions. That's the next point here. Now we go to this. I told you it's workplace interaction, briefing or handovers, and this is the time. I told you this already. Now let's look at these details. Listen and answer simultaneously throughout the test. From 1 to 42, you listen and answer simultaneously. Don't wait for special extra time to write at the end. As you're listening, you keep writing. Otherwise, you may forget what you've heard. You may lose out on that time. At least one healthcare professional is there in each recording here. The range of contexts are given. It can be any context. Like I said, it could be a dentist talking to another dentist, or it could be a pharmacist talking to somebody else. It could be a physiotherapist, it could be a nurse, it could be a veterinarian, because veterinarians are also eligible for the OET exam. So it will be a range of different contexts. Generic questions, they are all generic hospital-based questions. So don't worry about, this is not my profession, how will I answer? Suppose a veterinarian is talking about animals. You may think, how will I answer? I don't know much about animals and their treatment. It doesn't matter. Whatever questions are given, they're very generic, things which you can understand. Usually there will be one speaker, or there may be a discussion between two speakers. This is about part B. Let's look at strategies for part B. If my slides don't move, please tell me. We have moved to the next slide now. Questions 25 to 30, that's part B. 1 to 24 is part A. 25 to 30 is part B. You have ABC options. You have to just shade the circle of A, B, or C. Look for gist questions. As I told you, see the summary. Gist will be an overview of information, not one specific detail. It's an overview. You look at it from a bird's eye view, like look at it from like an umbrella. You're covering everything there. You need to look at the overview of the information and not a specific detail. And also, you need to look for information which is rephrased. You may have one in your question booklet. The phrase may be given in a particular way, but the way they say it in the audio may be rephrased. They may twist the subject and verb and object. The audio, you may hear the subject first and then the object. In your question booklet, you may have the object first and then the subject. The meaning is absolutely the same. So don't get nervous. Don't think they're saying something different and it's not relating to the question paper. Don't worry. It all means the same. You just have to see how they've rephrased things. So you have to be very good at picking up language. language, spoken language, and the written language. You have to correlate both. Look for details also, not just the overview, but also details are important here. Look for specific details in the recording. Look for synonyms. Like I told you, maybe one word in the question paper, but a different word what is being dictated. The meaning is absolutely the same. Those are called synonyms. Different words giving the same meaning are called synonyms. So look out for those. Also look out for parallel expressions. Parallel expressions are more than one word. When there's a phrase used when speaking, a different phrase given in your question booklet, both the phrases relating to the same meaning, that is called a parallel expression. They are expressions, but they're moving parallelly. The meaning is the same. If it's a synonym, it's one single word. If it's a phrase, then we call them parallel expressions. Look for parallel expressions and synonyms. Look for the speaker's purpose. Think about what is the speaker talking about? Why are they saying this? What is the aim of the speaker? Look for the functions. What one of the speakers is doing something. Maybe one nurse is saying, I dressed the wound of the patient. I bandaged it. I cleaned it and applied the medication and bandaged it. That's the function. Another person may say, I bathed the patient this morning. Now you have to give breakfast and medication. I'm leaving my work. I'm off duty. Now you're taking over. So you're handing over charge and saying what are the functions you have performed and what functions are remaining to be done. So all this will be discussed. Understand the actions that their language describes. When they're talking about the language of what you hear, the dictation or the audio clip, what are they talking about? What actions have been done? What actions are remaining yet to be done? You have to follow that. Look for opinions, like I said. Identify the opinion of a speaker on the issue discussed. There may be an issue with the patient, a health issue. You pay attention to how the speakers are saying things, how their attitude towards the topic is, how one person discusses their opinion. Now, there may be some issues on agreement. Identify what the speakers are in agreement about, and sometimes the professionals may not agree. One nurse may say, I think this is about this patient. Another nurse may say, no, I think it's something different. Or a doctor may say, this is my opinion. Another doctor may have a different opinion. Listen to how they talk about their beliefs and their attitudes and their opinions, how they express it, how at the end they come in agreement. Here, you listen to the conversation and pay attention to the reaction of each speaker. What's the reaction? Are they getting angry with each other, or are they saying, okay, yes, I understand your view is this, but my view is different? How they respond, how they react to each other, each speaker, when another person's suggestion. Then how do they finally concur? Concur means they agree with each other. They agree with each other and come to a common decision. Okay, these are all the points of view we discussed. We have our different opinions. Fine. Now we'll take the course of action. So that is course of action. What is to be done? Each professional can't do something different. Obviously, you have to come in agreement and then say, okay, now this is the course of treatment. We are going to follow this for this patient, X, Y, or Z. So decide what the speakers will do as a result of the conversation, the talk. Pay attention to anything that will be done later while listening to the recording. Be aware of when in the future the actions will be done. So, okay, let's discuss. We discussed this. Now, this is what has to be done. We'll agree upon this. Now, when it has to be done, who has to take care of it? All those details have to be finalized. How many days should this treatment continue for? Okay, we'll try this for 1 week. If it doesn't work, let's again discuss and see, and we'll do something different. So all the time, you are keeping in touch with each other. You're discussing the patient's details, and you have to discuss the course of action accordingly. And be aware of the future. Will this follow-up be done after 1 month or 1 week? Or when should the next injection be given? When should the next dose of chemotherapy be been given, or the radiation? How frequent it should be? When should it be done? All that has to be also detailed there. You have to pay attention to these. Now let's move on to Part C. Part C, as I said earlier, here there are two extracts of bigger, longer length. Time duration is 4 to 5 minutes. You listen and answer simultaneously. Here they are, these are presentations or interviews. They're called presentation extracts. The first extract is called consultation extract. A. Part B is called workplace extract. Part C is called presentation extract. So you may have one person talking on a particular topic, or it could be an interview. Somebody is interviewing a medical professional on a certain healthcare related subject. Words indicating the examples and theories. They'll be discussing some theories. You have to listen for the words and the examples used there. You'll have you have 90 seconds before the recording. Sorry, this is not 30, it's 90 seconds before the recording begins for each section. Each extract, two extracts are there. So for each extract, you have 90 seconds to prepare. And you have 6 questions here, 6 multiple choice questions. And you have to choose one answer. You cannot choose 2. And it should be not from your medical knowledge. It should be from what you hear. Even if it's different from what you've learned in your college and medical school, it's okay. You answer from only what is given in the audio clip and not from your medical knowledge. So you have to just shade the circle as to whether it's A or B or C, whatever you think best suits the question. Now, these are workplace interactions and podcast style interviews. The interview will be a podcast style between 2 people. Maybe a TV, a personal from a TV channel could be interviewing a healthcare professional and things like that. Last year, I heard one talk between the Jayadeva medical director and one of the TV channel personnel. They interviewed him on the coronavirus and the prognosis. At that time, there was no even vaccine developed. So the medical director was talking about coronavirus and probable causes and the effects, repercussions, how it's affecting the millions of people, and how they were developing the vaccinations at that time. So it could be anything like that. It's not just coronavirus. It could be anything, all related to healthcare related topics. So these are all broad in topics of healthcare interests, okay, or broader interests of healthcare related topics. Let's look at the strategies for part C. Let's look at these one by one. There are a lot of points, but most of these I've already covered. From questions 31 and 42 is the first extract. You'll have to choose between A, B, and C. That's 12 questions, 6 and 6. So 31 to 42 is 12. First extract is 31 to 36 question numbers. Second extract is from 37 to 42. Use the words in the presentation to highlight which parts of the recording relate to which questions. While you're listening, I told you they will not give you the question number, because one person is talking about an issue or a topic. They can't say now we're on question 31, 32. It's a presentation style. It's like a person talking on a certain subject, giving a speech. They can't tell you question numbers. So you have to relate which part of the recording relates to which question. So you have to keep your eyes moving. Therefore, don't get stuck with any one particular question. If you go look at one question, then if you don't get the answer, you'll be stuck there and you'll miss out the further recording and you will not get the answers to the next few questions. So if you don't get an answer, just skip it and keep moving on to the next question. As I told you, in the end, you get 2 minutes time to go through the answers. That time you can go and try to remember what was missed out, or you take a guess, because there are no negative marks for your answers. So if you guess correctly, you'll get 1 mark. If you don't, if it's guessed wrong, you'll get 0. If you don't answer it, it's also 0. So it's worth taking a guess and just take a chance and write whatever you think suits best for that question. Pay attention to the keywords in the question. As I said, keep underlining keywords in the question and in the options. They're all MCQs. Look at the general meaning and gist of what they're talking about. This tests your understanding of the arguments between what they're talking about, the attitudes and the opinions of the speaker who's talking. What is his or her attitude on that particular subject? So you have to listen actively. Listen actively means put yourself in that position and listen actively and pay attention to what they're saying. Correlate the words in the question with the recording. I've already told you that. Pay attention to keywords, underline keywords. Questions include the results of trials of some medication or some injections or some tests done, case studies done. What are the result of trying out certain treatment on certain, maybe it's on the monkeys, or it's maybe on the rats, guinea pigs. So whatever tests were done, you see the results, the studies of the results, and the results of the trials done. And they will give case studies. You listen to the case studies also, and how what were the decisions made based on those case studies. Remember to read the questions first. In the 90 seconds time you have ample time to go through the 6 questions and MCQs. So read through them, underline the keywords, then start listening when the audio plays. But you should not press the play button or stop button. Automatically it will pause and automatically it will continue playing. You don't have to touch any button. Just listen from 1 to 42 continuously. They will provide the pauses in between. Even in the exam, it will be played centrally from a central system. You will wear your headsets and you will answer questions. You don't have to touch any button there. During the training, you have to play it on your system. So you just click from 1:42. Don't stop it in between. They will give you the time in between to go through questions. As soon as the audio starts, you look at the questions and start answering simultaneously. So that's how the test is done during the classroom sessions. Remember to read the questions, underline any important word. Topics are not specific to any field. I told you they're generic. It could be on pediatry, it could be on cardiology, it could be on psychology, it could be on it could be on pulmonology, it could be on veterinary cases, it could be on dentistry, anything. They're all the 12. It could be on pharmacy, it could be physiotherapy, anything. 12 professionals who are eligible for OET, it would be covered in any of these 12. So the topics are very general, not specific to any one particular field. If the topic is unfamiliar to you, do not worry. Why you should not worry? Because information needed to answer the questions are all given in the recording. Whatever you need to answer is given in the recording. You just have to listen carefully and answer them. So your listening skills should be good. They're not checking your medical knowledge, they're checking your listening skills and assessing you on that. So even if you know nothing about it, if you don't have any prior information also, don't worry. Whatever you have to answer is provided in the audio clip. You just listen, be calm, listen carefully, and you will find your answers. So that is the end of part C. Now let's look at some general listening tips. So we have to look for the fixed form. This is a fixed format, standardized instructions. It doesn't change from one test to another. It's always the same. Format is the same. Be familiar with the instructions. They're all on general healthcare interests. It's accessible to candidates of all the 12 professionals. Use the time given before to look at the questions, read through the questions, underline keywords, multiple choice questions, underline important words. Write clearly from 1 to 24, write clearly and legibly. Don't scribble because 1 to 24, you have to write the words for fill in the blanks. Write clearly, even if it's not neat, letters should be clear and distinct. A should not look like E, E should not look like I. Each letter should be clear. And note completion questions, underline important words before and after the gaps. Recording will be played only once. Record your answers as you're listening. Write your answers. Don't wait for the end because you'll forget. It's played only once, so you can't play it again. In the gaps in part A, write the answers. Section B and C, you have to shade the circle. No negative marks for incorrect answers. It's either 1 or 0, no -1, -2. If you miss an answer, move on, return to the question later. Listen to English accents every day. Expose yourself to various accents. It could be a Britisher talking, an American, Australian, Russian, Arabic, Indian. It could be any accent. So the best thing to prepare is every day listen to various accents. On YouTube, we have lots of talks by people of different origins, different countries. Start listening. Listen to podcasts on YouTube, listen to videos, listen to TED Talks. All this will help. These are the 12 professionals who are eligible for the OET test. Nurses, medical doctors, physiotherapists, dentists, pharmacists, veterinarians, occupational therapists, speech pathologists, dietitians, optometrists, radiographers, and podiatrists. So these are the 12 professionals. Right, so that is the end. Now you can just look at the learning resources we have for listening. If you go to these channels on YouTube and in Google them, ABC, Australian Broadcasting Corporation, you listen to these programs, All in the Mind, Health Minutes, Health Report, Life Matters. In BBC, that's British Broadcasting Corporation, you listen for programs like Health, Health Check, Inside Health, Science and Action. You listen to these are good resources. Sometimes, you get some information which might come for your exam. You never know. All right. So that's the end of this PPT, the listening subtest in OET. Thank you very much for listening. And we'll close the PPT session now.